So we're talking here that the body has an innate desire to resist disease and achieve and maintain normalcy. That each cell has built into its genetic code the desire to repair, heal. Just like you cut yourself with a knife, you can heal itself. Well, that's the whole basis of natural healing, is that when you remove the things that put stresses on the system, and you put back in the things that the optimal nutrients and the optimal environment for the body to heal itself, you just allow the body's natural tendency to restore itself to normalcy to be fully manifest. So the blood pressure comes back to normal, your weight comes back to normal, right? And even in autoimmune diseases and allergies, those things can come back to normal too. But in some cases, it takes years to get back to normal. But nevertheless, in the vast majority of cases, people still get back to normal again. It's only in the more advanced cases, people who've used drugs for many years, or the real tougher cases that can make improvements and not totally get back to normal. But even in those cases, the amount of benefits are often remarkable. Even with regard to infections, keep in mind that two things. Number one is that the body still has the ability to fight off infections, viral infections, and even bacterial infections. So when we take an antibiotic, for example, which only works on bacterial infections and not viral infections, even then the own immune system plays an important role in your body's able to contain the infection and fight against it. So the antibiotic is not the thing doing all the work. And in many cases, the body can fight away and defeat and win over mild bacterial infections and prevent those infections from taking hold. One thing we have to be very careful of is that so many diseases in this country are caused by doctors and caused by the use of drugs, and that antibiotics, anti means against and biotic means life, antibiotics, anti-life are poisons. They're some of the most poisonous materials in the medical arsenal, and they can save lives in people with a life-threatening infection. Cellulitis, an infection, important for Lyme disease, important for meningitis, important for pneumonia. Unfortunately, more than 95% of their use are for diseases in which they have no effect on. And when they're taking them for diseases where you have a sore throat, you have a cough, you have a viral infection, the doctor diagnoses you and gives it a fancy name, right? It's a cold, right? It's a viral infection. It's an upper respiratory infection. And he gives it a fancy name like bronchitis. Does that mean you're supposed to take an antibiotic for it? Of course not. Calls it sinusitis, calls it something else. It doesn't mean that you should be taking antibiotics. As a matter of fact, we're talking here about studies looking at standard Americans eating junk food diets, and there's no medical organization or authority in America that recommends antibiotics for bronchitis or sinusitis because it's not effective. What it does is it kills all the good bacteria and has you overgrow now more bacteria in the future that are more susceptible, that are less susceptible to antibiotics, that are more pathogenic, leading to more serious diseases the more you take antibiotics. And there's some relationship between the multiple use of antibiotics through life and cancer later on in life. We want to try to avoid the use of medicinal substances as much as we can. And this is including for all drugs, especially with regard to autoimmune diseases, because with autoimmune diseases in particular, the drugs that the rheumatologists are using are chemotherapeutic agents that were originally designed as to fight cancer and to kill cells. And people who are being taken these drugs for autoimmune diseases, like Plaquenil, like methotrexate, like Imuran, like Remicade, like Enbrel, these drugs that are effective, their efficacy is proportional to the toxicity, and the rheumatologists and the gastroenterologists reserve the most toxic drugs. As you fail on the least toxic drugs, they hold off giving you the more toxic ones, eventually leading you to the most toxic, like Remicade, for example, which have the highest rates of producing a later life cancer. But all these drugs are linked to later life cancers. So it's very important that it's so critical here that people understand that with all these diseases, like rheumatoid arthritis, like lupus, like psoriasis, like scleroderma, like ankylosing spondylitis, like all these diseases that bring, like colitis, all these diseases that bring people to see physicians and rheumatologists, be treated with nutritional therapy first. You don't give them drugs for 10 years and then have them find this in some back door, right? We want them to let people know that the first treatment is nutrition before you result in dangerous drugs, and that all people should see this as a first line of therapy. Because there's no downside, and most of the time it works. And it works more effectively than drugs, and so many times when the drugs don't even work, nutrition works better anyway. Going back to a little review here, we're going about medications, blood pressure medications, and increased risk of death. We're saying that when you have high blood pressure, the first line of defense should not be medication. It should be diet and lifestyle and exercise. Beta blockers increase glucose intolerance, which predisposes a person to diabetes. It raises your glucose level. If you're diabetic, it makes you more diabetic. If you're not diabetic, it makes you more prone towards diabetes. They also have the effect, the pseudo-antihypertensive effects we're talking about, because they fail to lower central nervous system pressure, which means the blood pressure in the brain is not lowered. Right? It's the fourth most commonly prescribed drug in the United States. Yet the meta-analysis shows no mortality benefit for simple hypertension. They don't work, but it's the fourth most prescribed medications in the United States, but hardly work at all. In other words, we know these medical profession, the studies show that these medications do little to help people get better. It doesn't lower their risks, but we give them to people anyway. And the tragedy here is we're not giving them information that they could have taken back to their own homes to save their lives. We're allowing them to die when they don't have to by giving them the drugs as the primary mode of treatment. This is other medications to lower blood pressure. Diuretics lower potassium. All these drugs can cause impotence, but they all cause lightheaded, right? To pass out, more likely to fall, break a hip. ACE inhibitors can cause kidney damage. Calcium channel blockers, swollen ankles and feet, constipation, headaches, flushing, heartburn. Well, that sounds like every person in America has that just from American food, right? They have reflux, but it worsens all these things. So you're already constipated and have reflux already. They're popping pills. And the ARBs, which I always thought were the safest medications, are now found to have angiogenesis promotion effects, which are linked to kidney cancer and increases all cancers when you take these medications. And so any medication that lowers blood pressure has the potential to cause irregular heartbeats, atrial fibrillation, predisposing to PVCs or premature ventricular contractions, and lead to sudden cardiac death. We discussed yesterday how overall medications give you minimal benefits and give people a permission slip. If they're used, they should only be used with people with very high numbers who can't get their blood pressure down, who are already maximizing out on everything they can do nutritionally and through exercise and through salt avoidance, which is almost never the case, right? How many people you know have maxed out on what they can do nutritionally, then resort to blood pressure medications? Like nobody, right? Beta blockers increase the risk of stroke risk because they don't lower central nervous system blood pressure, and they allow people to think their blood pressure is protected. And reduced diastolic below 60 has 3 times the heart attack rate and dramatically increases the risk of heartbeat. That's most people taking blood pressure medications, especially as you get older, the blood pressure medications become more and more dangerous, because it's probably better when you get older to let the blood pressure run a little higher as opposed to bringing it down and getting the diastolic too low. Autoimmune diseases we're talking here about, this is a very serious problem in America. We're talking about lupus and rheumatoid arthritis and 80 other diseases with all kinds of different names that are autoimmune, where the body attacks itself, and they're all interrelated, right? Psoriasis and colitis are both autoimmune diseases. They mostly occur in women, but they're a major cause of disability, and they have such a negative effect on these people's lives that they're a very, very serious problem. And they're not predominantly genetic. That's the thing. They're not tracked to genetic causes. They're tracked predominantly to environmental causes, especially environmental causes occurred during pregnancy, leading to autoimmune disease in the offspring that usually occurs to manifest itself when the woman is in their 20s or early 30s. In other words, so you don't see it in childhood as much, but they get to be 25, 30 years old, you see these diseases manifest itself, and we find that if we look at the scientific literature, we find the same factors here are causation. Bacterial challenges. In other words, when we're raised in an antiseptic environment, the frequent use of antibiotics in childhood, killing out the good bacteria that inhabit the gut, increases your risk of autoimmune diseases. People that are raised with animals, like dogs, have lower rates of autoimmune disease in lower animals because they bring dirt into the house and the environment is not as antiseptic. People who live in poor countries where they live on dirt floors, huts and not have where everything isn't as clean, have lower rates of autoimmune disease, lower rates of Crohn's and colitis because they're exposed to more bacterial challenges. As we keep everything so clean, as we use antiseptic hand washes, as we take antibiotics all through life, it increases our risk of autoimmune diseases because we're not exposing ourselves to the normal bacterial challenges. We overwash everything, we keep everything so clean, right? Our immune system never gets challenged. We get more prone to autoimmune diseases. the increased free radical productions we talked about. Every mouthful of food you take in is either increasing or decreasing free radicals. There's almost no in between. When you eat foods that have no nutrients in them, you're increasing free radicals, and when you eat foods that are nutrient rich, you're decreasing free radicals, right? There's almost no halfway measures here. Vitamin D deficiency contributes. Fatty acid imbalances are a major factor inducing the susceptibility of people with autoimmune conditions. And of course, excess calories fuels an excessive immune response, especially excess animal protein. Because we're animals. Let me explain this. That people who have a tendency to develop autoimmune diseases like psoriasis and Crohn's disease and rheumatoid arthritis, they have what's called leaky gut. More likely percent of having leaky gut, which means the cells that line the digestive tract lining are stuck together with a material called a tight junctions, hold them together like glue. And if the cells start to separate, the scientific term for that is called a leaky tight junction. And it's really just descriptive of what it is, a leaky tight junction. And we find that when you have leaky tight junctions, you're more prone to develop autoimmune diseases because there's some space between the cells that microscopically line the digestive tract. Now, when our body digests protein, we secrete enzymes to digest protein, right? We eat the broccoli protein, the enzymes, the proteases break it down. And a protein is many, many hundreds of amino acids linked together with a chemical bond. And the enzymes break the chemical bonds linking the amino acids together, so it liberates an individual amino acid. And that individual amino acid is then transported not through the tight junctions, but through the cell wall by active transport. The cell transports it through a channel in the cell from the digestive tract lining, which is outside of the body, into the bloodstream, which is inside the body. Comes in the body, and the body takes a look at that amino acid, and the immune system says, "You're a good guy, come on in, we want you." Right? But the problem is that in the process of breaking down these bonds, sometimes in a person that has leaky tight junctions, full pieces of peptides, which are amino acids still with links, still with bonded together to other amino acids, maybe a 5 or 10 amino acid link, goes through the digestive tract wall and passes into the bloodstream. It hasn't been broken down all the way, right? And the immune system looks at that pattern of amino acids and it produces an antibody to label it for removal because it labels it as a foreigner or as a protein or as an allergen or like a virus or a bacteria that has to be removed or attacked, right? Now here's the thing. When we overeat on protein, because we're primates and we have a limited capacity to handle protein compared to a carnivore like a lion or a tiger, that the proteins, we eat a diet very high in protein, lots of animal products, the body's going to take a long time to digest that food. And a lot of peptides are going to be floating around. You're not going to efficiently digest it and absorb them as they're being conformed. We're going to have a lot of effort, and more peptides will float around, more will be transported and absorbed into the tissues. And the sequence of amino acids on animal proteins more likely resemble the same sequence of amino acids on human tissue, because we're animals. Whereas the sequence of amino acids on plant proteins don't resemble human tissue much. So when we produce an antibody to that peptide was be absorbed, it can cross-react now in the skin and cause psoriasis, in the kidney and cause lupus, in the joints and cause rheumatoid arthritis, in the colon and cause colitis. We're more likely to, the antibody production now that's produced is overproduced, and we're going to attack our own tissue more from the reaction to animal proteins compared to plant proteins. And the lack of green material, the lack of these nutrients we're talking about that normalize immune function are able to better normalize the T suppressor cells that can control the production of the antibodies that are going on an unrelenting and uncontrolled attack. Once we get the immune system back to normal again, the body can better control the excessive immune response to antigens. So we're saying here that autoimmune diseases are controllable and repairable through nutritional interventions because we're starting to understand the mechanisms. And the research on diet and autoimmune disease supports the high cruciferous vegetable intake to support the T cells and the production of helper cells and the normalization of T suppressor and T helper cells to prevent an overabundance of antibodies from being produced. So we're talking about a plant-based diet because animal protein can be excitatory to the person with the immune system. And sometimes we know cases where people just switch to a vegetarian diet, not even the best diet. Like even a rice-based diet, they do okay because they just lower the animal protein in their diet. But vitamin D adequacy and pumping up a level of fish oil. Now fish oil we sometimes use as a drug here. We're not using for its nutritive benefits. We're using it for its pharmacologic effects because it's less toxic than taking Plaquenil and methotrexate. We're not using it for a health food here. We're using it because fish oil has immunosuppressive effects. In other words, it's hurting the immune system, making it not react too much when you use fish oil in high dosages. And fish oil is sometimes used in a high dose with a person with colitis or psoriasis to suppress the immune system in the interim period until they can get healthy enough to not overreact. So it's almost used as a mild drug to differentiate using fish oil nutritively, right? Using it nutritively would be a low dose if you supply it with DHA, and using it pharmacologically in a high dose to have immunosuppressive effects that also has some mild risk but not significant risk. A review of the scientific literature concludes, a review not by me, but by people doing meta-analysis of the autoimmune disease and nutrition, report that dietary manipulation, it works. It works and it gives people a control over their disease. That's what the medical literature reports, but not what all the societies and medical authorities report. They refuse to admit, promote, or teach patients that nutrition plays a role in the management of autoimmune diseases. So to review, genetic defects may control susceptibility, but they contribute to, but they don't determine disease. The biggest determinant of disease, like other diseases, is not genetics, it's environment, it's diet, it's the things we're doing wrong to create disease. So we talked something about this, right? We know that inflammation has positive effects, and we're going to talk a lot about this more with regard to headaches and why people feel ill. So this slide is just to remind us that the decreased amount and the decreased function of T suppressor cells are reported in all types of autoimmune diseases, and that when we eat a diet rich in vegetables, especially green vegetables, it's been shown to improve the function and amount and production of T suppressor cells. So we can more better control that. Drugs for autoimmune disease, when people are tracked, we find that there's a dramatic increase in cancer. So we're talking here about a group of doctors called rheumatologists, and that specialty evolved because we need these specialists to be experienced in giving people drugs that cause cancer. The reason the general practitioners and family doctors don't use them is because the drugs are so dangerous. And they want the rheumatologist to monitor the blood tests and stop the drugs before people get cancer. But it doesn't ever work that way, right? They just give the people the medications, and when they get cancer, they get cancer. And they stop the drugs once they find out the things are abnormal, and then it's usually too late. My autoimmune protocol, obviously, is a high-nutrient vegan diet, rich in green vegetables. We sometimes add smoothies or vegetable juices to increase the absorption of these beneficial nutrients because it takes months to build up the right nutrients in your tissues. They don't have to do that, but they increases the probability of building it up. We sometimes use high-dose EPA and DHA, but very often we hold off on that and trial that because some people are more down the road, and we can just start with a program without that at the beginning, with beneficial bowel flora. Sometimes we use beneficial bowel flora, the good bacteria, in high dosages, because the high amounts of the beneficial bowel flora, over and above what we give normal people to use even, can work like a filter or a block to block up some of those exposed, leaky, tight junctions, so you're not passing antigens through as readily. So it helps with that. And that's why the fact that you're eating raw vegetables and onions and beans that promote good bowel flora all adds to the mix. The extra zinc, the extra vitamin D, the extra iodine, the extra B12, all those things that improve immune function we're talking about here are helpful. And sometimes we incorporate water-only fasting when necessary, episodically, to reset the immune system to a lower degree of function. And very often I'll have a person try to accommodate water fasting and for example, they'll fast, we'll make sure they're eating healthy for a few months first, and then they'll try to fast for a day or two, just as a test, see how they do with it. And we find over time that if they fast for 2 or 3 days and a couple of months go by, they fast for a few more days, their body it learns how to fast better, and they begin to tolerate fasting better, and now they can fast 5 or 7 days with under less stress on their body, without getting so weak, without getting so lightheaded, and they do better. And we can sometimes have people, especially when they have Crohn's disease or ulcerative colitis, can you incorporate the diet with maybe with episodically fasting to keep their immune system in check. We find that sometimes it takes a year or even 2 years for the person to make a complete recovery. and the episodic fasting is kind of shoving their immune system back down again to a more normal level of function, and it'll pop back up again after the fast, but maybe not pop back up as high as it was functioning before. And when you keep shoving it down, it pops back up. You shove it down, it pops back up, and eventually it stays down much lower. I've had patients with very severe conditions at times, sometimes very severe lupus, that haven't responded to this autoimmune protocol. I remember, but sometimes it shocks me with the response that occurs even later. When I'm giving you an example of a woman who had a very severe form of lupus, where she would develop high fevers to 103, 104, and her body would swell, and she would get very sick. And after she worked with me for a year, we decreased her medications, and she was doing much better. And about, I guess, a month or two after we stopped all her medications, she flared back up again. This is almost after a year of doing the program. And she developed fevers to 102 or 103 again, and she fasted a few days. They didn't come down. So I started her back on some steroids again, and I stopped the steroids, did the diet, stopped the steroids. She kept getting fevers again. So I said to her, look, let's put you back on a little Plaquenil for 6 months. We'll try to do this again down the road. Go back on medication for a while, and then we'll, give yourself more time on the diet, and we'll try to wean you off it down again with a lower dose of prednisone. But in some cases it's just not going to work. So I didn't hear from her for a while, I wondered how she did, and then she called me up, and I said, well, what happened? I lost touch with you for the last 8 months. Did you follow my plan? Did you go back on the Plaquenil? And she said, no, I'm all better now. It was a year later. I'm all better. She said, no, I just suffered out the fevers for like 3 months, and eventually got well, and didn't even take the drug. And I said, wow, and I was quite shocked that she got better, and she didn't follow my advice. But I was too, in some cases, the doctor becomes too nervous. I get too nervous to see the person continue suffering, continue sick, continue feeling bad, and sometimes the disease can be dangerous even. So I've got to take more precautions, but in this case, she didn't follow my advice, and she actually made a complete recovery, but it took her 2 years to make a complete recovery, The Lupus Foundation of America says, advocating an excess or exclusion of certain types of food, this is their official statement, is much more likely to be detrimental than beneficial in any disease, including lupus, right? This is the official statement of the Lupus Foundation of America, in spite of the fact that a review of the literature, a meta-analysis, shows quite the opposite, right? As well as the fact that, that doctors have no interest in this stuff. When my patients that make recovery from lupus, and I see so many lupus patients that some days I'll see 4 and 5 patients with lupus in one day, that they'll be sitting in the waiting room and there'll be one lupus patient after another. It's such a disease with so much prevalence, especially in young women. And I've even had a young girl who was on a national renal transplant list waiting for a new kidney because her kidney function was so bad because of lupus, who made a recovery. The point is that these people are so grateful. It's almost worse than having a person choose to eat junk food and have a heart attack, like in Joe Cross's movie, the people knowing they're doing it to themselves. But here people are trying, they're going to doctors, they're willing to do anything. I often tell people that when patients come to me with lupus, they'll say to me, I'll eat sawdust to get well. They'll be compliant with anything you give them because they're so anxious to have their life back. And they're so sick of taking the drugs that are making them feel sick that they're still feeling sick over, right? And they'll do anything. A tragedy here is that these people are highly motivated. They'll do anything to get well. And that's what's great about working with these patients. But nobody tells them. Matter of fact, when they go back after they've gotten better to their rheumatologist to show them they're better, the rheumatologist will throw them out of the office, yell at them. I had one woman come back to me. Her name was Deborah. She comes back to my office crying. And I said, what are you crying for? You got well from your lupus. Because the doctor screamed at me, he threw me out of the office, because I said, well, that's his problem, You're better. Her face was burning with heat. She had red rashes all over her face. She got well, went back to the rheumatologist, kind of bragged to show him, how it got well, and he got angry at her. Like, oh, if some remissions happen, I don't have to see you, or something like that. They didn't ask her what happened, what she did, nothing. Just anger. It was like, it's almost as if, it's really weird. And here's the hands of somebody who's here, right? And a case of lupus where I think that as more time passes, she'll still get better and better. So you can see that we make progress, even with patients that don't make a complete recovery right away. They still get a lot better, and they can come off medications, and they'll continue to get better as time goes by. And that's been my experience with many people that with multiple sclerosis, people make recoveries psoriasis, lupus, rheumatoid arthritis, Crohn's and ulcerative colitis, lots of great patient case histories, hundreds of patients in the last 20 years with people with all these autoimmune conditions. And acne is another disease very troublesome to people. Not as severe, of course, as something like rheumatoid arthritis or painful, but it still can, have a strong effect on people. And the official recommendations of the American Academy of Dermatology, that they propose that scientific studies have not shown a connection with diet and acne, and food does not cause acne, not chocolate, not French fries, not pizza. This is the official statement of the American Academy of Dermatology. What does the research really show now, right? It shows milk consumption and acne, that milk consumption is related to acne, that sugar consumption raises insulin is related to acne. The studies do not show what these official medical people are saying, that acne involves overproduction of oil, bacteria on the skin, inflammation, and of course the studies show that the production of keratin, oil on the skin, and acne and sebum production are related to certain hormones like insulin, like growth factor 1, which we talked about this week, testosterone and high amounts of DHA. And these same hormones that are raised in acne are the hormones that cause prostate cancer and breast cancer. So the same dietary milieu that causes acne is in your teenage years increases your risk of prostate cancer and breast cancer. So it's important not to have acne, or at least to have a diet that decreases the risk, because one mechanism here is that when you have a higher level of circulating insulin from eating sweets and sugars, then the higher level of insulin has an effect to decrease production of sex hormone binding globulin, which keeps testosterone and DHA and insulin-like growth factor at a lower level. And the dietary components that most affect this, of course, are saturated fats and vegetable oils, high glycemic foods, especially white flour and sugar and soda, dairy proteins, and a lot of concentrated animal protein diet, which raise IGF-1, low antioxidants, phytochemicals, vitamin D and omega-3 insufficiency. The same protocol that's like you could say has the anti-cancer protocol, has dramatic effects at improving people's skin and having teenagers and young people not have acne. And some of these people too embarrassed, even I've had patients were too embarrassed even to go to college and wanted to stay home from school because their skin looked so bad. And watching these young people make recoveries has been very, very rewarding. And so many times when they try all these drugs, creams, and very often antibiotics orally don't work, and they're dangerous, right? They're increasing a person's risk of cancer, and doctors are putting on them for years. And then you go to a dermatologist, and what are they giving you? Accutane, right? Which can cause major depression, suicide, dramatically increased risk of cancer, severe dangerous drugs to be giving a person when simple nutritional changes could have been effective. Likewise, people with severe headaches can be really troublesome to people's lives, so much so that there are many people I see as patients running around from doctor to doctor for many, many years with headaches so severe they can't function, they can't work, they're on disability, they can't go to school. One young girl, her name was Renee, 15 years old, in bed for 3 years. It's like 7th grade, 8th grade, or 9th grade, did some special tutoring, but almost was suicidal. She was hospitalized in Johns Hopkins and also went to various hospitals in Brigham Young in Boston, where the top headache neurologist in the world would give her intravenous experimental drugs to see if they can break the severity of her headache being so severe. When she saw me and I put her hand into the antioxidant machine, it came back 0. The machine couldn't read anything, right? There was nothing in there. But her mother claimed she ate a healthy diet, of course. No doctor ever did a blood test to check any nutrients on her, folate, B vitamins, D, zinc, carotenoids, anything. No one ever looked at her diet. All the top neurologists in the world, obviously. After 1 month of eating healthy, she still wasn't better yet, and her mother called me up a little disappointed. And of course, the disappointment was understandable because they'd been to like 50 doctors already. And her kid was horrible. But of course, she made a complete recovery. She's a wonderful young lady. She was now in college. She gets up to these lectures and she'll tell people her story of why she eats the way she does and how she has her life back. And she's was on the school lacrosse team. She now runs track at a college. She was running for the school president. Very intelligent and lovely young girl now. But in any case, I'm just bringing it up because I see so many patients like Renee, with severe headaches that make complete recoveries, just essentially the same things we're talking about here. By giving their body the nutrients to detoxify, because people with prone to headaches have a blood-brain barrier that passes toxins through easier, and they don't have, and their liver usually doesn't detoxify well, and they're just susceptible to things. They're sensitive to things. They're very susceptible, very sensitive to toxins. When they start eating healthy with the soups made with cruciferous vegetables, with drinking vegetable juice, and stopping the medications, the key to getting them better is stopping the medications, because the way the medications work is because they inhibit detoxification. It's like a person using caffeine to stop caffeine withdrawal headaches, right? So medications work, and people never can get off that merry-go-round. A lot of these patients are on high-dose narcotics, and they need medical care. They need my medical care, or a doctor like me, to slowly taper them down off the medications as they're instituting a healthy diet, so we can get them. And then on working with them with compassion and understanding that this is going to be a painful process, and you're going to have to get well is going to take some suffering, because we can't just make the headaches go away until you're really off all medications. We have to do that gradually, and as your nutrient levels get high enough, and it's going to take a few months as we wean down and your nutrient levels go up. But they understand that, and they're willing to undergo the detox process and get well, and of course avoid triggers, especially processed foods. Let's talk about depression, okay? Let's review the cycle of depression, because this is important. Because the treatment for depression naturally is much more effective than medication, especially if you institute it when the person first gets depressed and not have them be on medications for 25 years, because the chronic use of medications over many, many years has the effect of suppressing the body's production of serotonin. So now if you try to stop the medication, this person is chronically and possibly forever serotonin deficient. Did you follow that? It's like a person requiring thyroid medication for the rest of their life because their thyroid is cooked. Well, likewise, these people put on high dose of these medications when they're young in life and kept on them at high doses for years and years. It cooks out the cells that produce serotonin, and they can become chronically dependent on these medications for the rest of their life. Nutrient levels play a role here. Omega-3 fatty acids play as a role. Vitamin D deficiency plays a role. And light plays a huge role here. So at about 10 o'clock at night, our body produces a hormone as it gets darker out called melatonin. And that melatonin makes us more drowsy and puts us to sleep and puts us in a resting phase of catabolism where our body is most effectively doing repair and detoxification of the brain, repairing brain cells, healing and detoxifying the brain in the sleep cycle. And melatonin aids in that repair and detoxification. And then when we wake up in the morning, you see the level drops precipitously, like off a cliff, because we're exposed to bright light, and light stops melatonin production in the morning. Now don't forget, melatonin helps the body detoxify and heal at night. And the detoxification and repair process at night is linked to lower rates of cancer, especially breast cancer. So if you're sleeping and you're exposing yourself to light, and if you're sleeping with lower levels of melatonin, you're going to be at higher risk of breast cancer. Let me say that one more time, that if you put a night light on, if you let your TV run at night, and you're sleeping with the television running, if you're sleeping with lights on in the room, if you're a person who works during the night and wakes and sleeps during the day, and there's a lot of light in the room, even coming through the eyelids, that as you have a room with a higher degree of light, you are going to not get maximum melatonin production, and that's going to have an effect to increase the risk of breast cancer. So obviously, don't fall asleep with the television on, and sleep all night with the light shining on your face. But if you wake up in the morning now, and you don't get exposed to light in the morning, so the level of lighting in an indoor room in your house does not compare in brightness to the level of sunshine in an outdoor environment. And for many people, especially women, the brightness of outdoor lighting is necessary to stop the melatonin secretion. And so what happens is melatonin continues to secrete into the daylight hours, which prevents serotonin from being produced. So now the lack of morning light prevented serotonin from producing adequately, and serotonin is the feel-good hormone, right? And is the antidepressant hormone produced by the body. And of course, what that does, because the body can only produce so much melatonin, the production of melatonin during the day lowers the melatonin curve at night. So now you don't sleep as well either, and you create this vicious cycle of sleeping and not resting fully, not detoxifying fully, and then less serotonin production during the day, and your serotonin and melatonin get mixed up, and you get more prone to developing depression. They used to do studies on people with seasonal affective disorder, women who got depressed during the wintertime, and they used to give them their light therapy. And about 30, I guess the large majority got better, giving them light therapy with seasonal affective disorder, and they started giving them light therapy with people with major depression that wasn't seasonal. And they found that that benefited about 30% of those people. And then they started giving people with major depression the last few years light therapy 6 o'clock in the morning, not just during the day, and they found that 80% of those people improved or got better. The efficacy of light therapy was greater than medications were, right? Medications have a much lower efficacy. But what if we mix vitamin D, fixing the vitamin D level which causes depression, giving them a high nutrient diet which makes the brain function better, and giving them light therapy? What if we mix all those modalities together, and also maybe some things that can help the stresses of their life? And then we find the efficacy is much greater than just handing a person a drug, without those potential risks of making them drug dependent. So here we have an antidepressant program, is early morning light therapy with obviously a bright light, and the best light for that is sunshine, obviously. We've researched and produced and make available some therapeutic lights for people who live in the Northeast and when it's not nice out, but the best time to get light therapy is with sunshine in the morning, and of course a high nutrient diet with flax seeds and walnuts. And the scientific studies have shown that for people who want to get well from depression, that giving them EPA works quicker and more effectively than DHA does. So this is a case where it looks as if using an animal product is better than using the vegan source, because we're just starting to develop vegan EPAs that will become available in the next few years. But up to this time in human history, in the history of nutritional science, the only omega-3 EPA and DHA we could make from algae are DHA. So that's why in certain cases of autoimmune conditions or depression, we're using a fish-derived product to give them EPA. And then, of course, once they're better, they can move to a vegan product if they want. And we usually give them enough to give them a decent dose of EPA. So the combination of EPA plus DHA is more like 1,000 milligrams per day in the phases. And of course, no processed foods that are going to interfere with the conversion. So lots of people have improved. Lots of my patients have made recoveries from depression and anxiety and obsessive compulsive disorders and mild forms of, and improved all types of emotional and mental disorders. And of course, insomnia as well. So to sum up, nutritional excellence protects and treats most chronic diseases that drive people to see physicians, right? And that we could change the face of medical care in America and all over the world. And the potential here is huge. The potential here is huge for people to not suffer as much. And forget the cost, the economic suffering, and the effect on our economy. But when you're a doctor, you start to be in touch with people who come to see you, and you realize how much these diseases have affected their life and made their life to be so almost tragic. And until they find some way to get well, and so much of the medical profession and the solutions that are available to them to going to conventional physicians are leaving themselves with unsatisfied and without a solution to their problem, because in most cases drugs are just inadequate, in addition to being risky.
I have severe Raynaud's, secondary to limited scleroderma.
Right.
I also have naturally very low blood pressure, like 100 to 110 over 60 to 70. But to control the blanching in my fingers, they've given me nifedipine, which I guess is a vasodilator,
right,
which also makes me extremely lightheaded. And I was just wondering if you could comment on that and whether I should be taking it, not taking it, or what to do for the Raynaud's.
Right. And just to make it clear, I don't consider blood pressure 100 over 60 to be low blood pressure at all.
Okay.
That's a normal blood pressure.
Okay.
90 over 60, normal blood pressure.
Okay.
Okay. But your blood pressure is normal, so taking medication to lower it pushes it subnormal.
Right.
It makes you, and for you, then you're normal. You don't feel as well.
Right.
So I'm hoping that whether you use the blood pressure medication or not right now, that you don't have to use it the rest of your life, and that you can make continual progress with this disease year after year, get better and better. And so I would try to see the lowest dose that can make you functional. And if you're doing well with the diet changes and the program, then we would try you off the medication and see how you do.
Okay.
So hopefully you could get off it.
I just have one more quick question. I also have primary biliary cirrhosis, and they put me on your sodiol, even though I'm sort of asymptomatic now. Do you know anything about that, and what do you think about that?
I think that you would only need that if you were symptomatic and developing some kind of blockages or sludging or where you were having pain, and you wouldn't need that if you were feeling okay. And certainly this program we're learning about here is going to help going to help you tremendously.
Okay. What are your thoughts about childhood immunizations?
I think that it's an experiment in human history. We're guinea pigs, and the studies only look acutely on what happens after they get the immunization, a week or two later, and detect whether and the risk factors for immunizations mean that they have a certain percent of people that get brain damaged or get hurt by the immunizations, and those people are rewarded who are damaged from a fund set up by the government to compensate those people economically. And because the medical profession decided that they're so important to give people these immunizations, that we actually make it mandatory and protect the manufacturers from lawsuits if damage occurs. And that there aren't long-term studies done, performed, or investigated to see if giving so many immunizations at such a young age increases the risk of autoimmune conditions or cancer down the road. So the answer is it's a complete hodgepodge of unknown information that we don't know. So I err on the side of caution and try to tell people that if you're in a high-risk category for hepatitis C, for example, if your sexual behavior, or if you're working in a hospital, you may get stuck, then maybe you should get that vaccine. So in other words, if your child is in an inner city and not being breastfed and living at daycare from their ages of 2 months of age with handlers that are filling the other babies and one baby after another, and they might be sharing bottles and they're high increased risk, and they should get certain vaccines to lower that risk. But the idea that we should have a cookbook medicine and give the low-risk people the same vaccines as high-risk people, to me makes no sense. And if I was in control of things, we would be following people over years and seeing the long-term effects of vaccines and not just the immediate effects. So I think there's significant risk potential there.
My son and his wife have tried to resist having some of the immunizations for their children, and the pediatricians have been adamant about giving them. And there are schools that will not take a child unless they've had those immunizations.
And a lot of doctors will drop you from your medical practice if you don't go along with the standard recommendations, giving kids 31 shots in the first year of life, as that's not potentially damaging to their immune system. So clearly, I have a lot of families with young children that come to me as a patient, specifically because they want more not cookbook medicine. To meet their needs and their desires without making to feel that there's something wrong with them because they don't go along with the party line.
The Platelet Disorder Support Association lists omega-3 fatty acids as a substance that can increase bleeding risk in people with ITP. Right. Do you know what level of omega-3 would be optimal for good health and would not increase the risk of bleeding much?
Yes, exactly. I was mentioning that in a nutritive dose, you're not going to get increased bleeding from using omega-3 fatty acids. And what I'm saying is that you don't need, for nutritive needs, for a person eating a healthy diet, we don't need very much. We need a little tiny bit extra to assure nutritional adequacy. So our healthy diet gives us some, and even for those that are poor producers, taking 100, 150, 200 milligrams of DHA a day is sufficient. It's not going to cause bleeding problems. But popping 3 or 4 fish oil pills with 1,000 milligrams each, going up to 4,000, or we use for autoimmune conditions like rheumatoid colitis, 2 teaspoons a day, which is 10,000 milligrams a day, is nowhere near the nutritive dose, which is a couple of hundred. That's 10,000. So the real problem with the bleeding tendencies come from the very high dose fish oils, which you're not really benefiting from nutritive effects. That's immunosuppressive effects. You following me?
Yes, you said 200 to 300.
I'm saying that, like in my DHA Purity, which I recommend that people take, only contains 180 milligrams of DHA per serving size. Because the studies show that 100 is the amount you need for most people to maximize the beneficial level in their red blood cell membranes.
So we take one of those a day? So
1/2 a dropper a day gives you 187. And I'm saying even if you took less than that, it's still enough for most people.
Okay.
So you don't need that much. Then you're not going. It's only the people that are taking fish oils, which are much higher, and taking lots of fish oils to lower their triglycerides, to lower their cholesterol, to thin the blood, to interfere with clotting, where you're going to see side effects like that.
So you would just take that, just a half of one of those but it wouldn't matter if you took some walnuts.
That's correct. If you were supplementing, if you have ITP, you can still supplement with DHA and eat walnuts and flax seeds and not worry about that because you're using dosages that are not going to cause increased risk of bleeding.
In patients with autoimmune disease, what levels of fish oil are recommended?
Well, you have to differentiate if I'm using it nutritively or pharmacologically. So sometimes with a person with bleeding ulcerative colitis, where the blood is coming out of, they're having 20 bloody bowel movements a day, we'll start them with a high-dose fish oil as one of their initial therapies in the range of 10 grams per day, which is 2 teaspoons a day of fish oil, because that's been shown in the studies to be most effective. But you're using it kind of like a medication, not like a nutritive dose.
What do you recommend for children and adults with attention deficit disorder, or ADHD too?
Right. I recommend that they take just a few basic supplements and eat a healthy diet. And we're talking about the essential fatty acids here, DHA. I usually double the recommended dose of DHA. Like instead of a whole dropper, not a half a dropper of DHA purity. They don't require EPA. They're not depressed. The DHA works okay. They can use the vegan version of it. And in those cases, we sometimes give them the supplementation that I give everybody else. Plus, we usually add green tea extract to that, or some other, like an herbal product to help their body get a little more focus.
Okay, and they can get off Ritalin or Strattera or whatever.
Well, we hope they're not on that stuff to begin with.
Yeah, true.
They're not on. Those are amphetamines. You know.
Okay, thank you.
And I think that it's very helpful to give these children the right type of environment, the learning environment that's not going to put them under stress. In other words, don't drug them to fit the school system's environment. Create an environment that's going to fit them so they don't need to be drugged, even if they still have that problem. There's no excuse to get, we're drugging them to make it more convenient for the teachers not to be, not to have to give the child personal attention, not to have to make the right environmental. And some of these children are very intelligent and just don't fit into the normal school environment. We have 30 kids in the class not getting attention. And they can't just stay there all day. They need naps, they need to have breaks and exercise, and so we're just drugging the kids so they exist better in that environment. It's not great for the long-term health.
I have a daughter-in-law that has eczema. She's about 75% vegetarian, not vegan. Is there anything you can recommend? Besides, I'm sure she needs to know that she needs to be on the high nutrient diet.
She needs to tweak her diet and make it more excellent. That 75%, that's the problem, is that moderate changes don't work, and that when people do the 75 or 80%, they put all that effort in and get no benefit out of it. Just going to say this, that when I was a world-class figure skater, and then I coached ice skating, and I had all these young kids who I was their coach. And I had a lot of fun. A lot of my students competed in international competition. And some of them were quite talented individuals, and they'd put in like 95% effort. And I'd say, you're a great athlete, and you're a great person, and a great skater, and you're putting in tremendous effort. You're waking up at 5 in the morning, you're skating for 3 hours, you're working out with weights, but you know what? You're not going to get anything out of this. You're not going to get to international competition because there are other people putting in 100% effort, and 95% effort isn't enough. And for some people with disease, they're putting all this effort in and not getting any benefit out of it. And the difference, I tell these students, I'd say the difference between 95% effort and 100% effort is just a little bit more you're not doing. But that little bit more that you're not doing is going to make all the difference in the world in your outcome. And so the answer to your question is that people with eczema have a tendency to be low in that enzyme called delta-6 desaturase that keeps their GLA levels low. And they need to take, in addition to the healthy diet, should be taking something like black currant seed oil or borage oil, in addition to everything we talked about here. But the bottom line is it still may not work because they need to do the whole program in its entirety and get really in great health and a great immune system.
Well, what I wanted to know also is there any blood tests or anything that they can take that'll test if there's something additional that they need in that high nutrient
That's
diet?
what the blood test will probably show. If they do the essential fatty acid blood test, they can tell whether those fatty acids are low and how much they need to supplement.